Hello there guys, my name is Dr. Ruful Aziz and I'm the general dentist from Srinagar. The purpose of this video is to kind of tell you what you need to do after tooth extraction to make sure everything heals up correctly. I'm going to talk to you about some after tooth extraction instructions that helps you to start the natural healing process and prevents for developing any further complications. So directly after tooth extraction, you will be discharged from the clinic biting down firmly on the 2x2 gauze pack that has been wrapped and stuffed over the surgical site. This gauze pack should remain in place for about 1 hour after we put in and after you left the office till a good blood clot has been formed. This is necessary for normal healing. Your dentist is gonna give you the cold pack or ice pack and apply immediately outside of your face on the side of tooth extraction, alternating for 15 minutes on, 15 minutes off. You will also receive a package of gauze packs from our office or from your dentist for the home care. Okay, cool. When you arrive at home on the day of procedure, for the first 2 hours your mouth may still be numb and do not accidentally bite on your lips or your tongue. Don't take the gauze out for the first hour after you left the office. And when you reach your home, you remove the gauze out from your mouth and you will find the extraction site is still bleeding. In this case, you can use the gauze pack provided by your dentist. You can change this gauze after every 45 minutes, but make sure one thing, that the slight or minimal bleeding is normal and needs no placement of gauze. Make sure the gauze should not be completely dry because the clot will adhere when you bite on it. And on removing the gauze, it pulls away the clot, so it's better to keep the gauze slightly wet. The proper way is to place a gauze is to fold a 2x2 gauze into the square and wet it with few drops of water or saline and squeeze a little and place that into the socket and firmly press and bite down on it. Make sure do not eat or sleep with the gauze in mouth, and you could also use a tea bag like moist tea bag instead of a gauze. That also works very well. Bleeding. Intermittent bleeding or oozing of small blood for the first 24 hours are normal and needs no placement of gauze. It's actually the saliva that's gonna mix it up with the blood and gives a feel as if it's the bleeding. Now we will come to the pain part, the pain. You are going to be in the pain for the first 24 hours and sometimes it's a little bit more when the bone grafting was done. So basically chance of having pain for the first 2 days. Please take the painkillers 1 hour after the procedure, right after you remove the gauze from your mouth. Usually after 1 hour, the anesthetics that was given for the procedure is still going on, so it's a good time to take the painkillers. And the painkillers took about 15 to 20 minutes to start acting before the pain comes in. I also want to tell you if there is an increase in pain from 3rd day to 7th day, if it is more than the first 2 days and you generally don't feel well, you may have a post-op infection and the condition called dry socket. For this, you should probably visit your dentist. Now the cold therapy or cold packs. Your dentist is going to give you the cold packs and apply immediately after the procedure on the side of tooth extraction. If it doesn't last so long, you need to go home and change it with your own ice packs or the cold packs, the routine ice packs that we are having in a freezer or refrigerator. You can wrap them around the towel or a handkerchief and place over the site and do it 15 minutes on, 15 minutes off until bedtime. You could do this for the first 24 hours and after that switch to the warmer stuffs. This will minimize the bleeding and discomforts. Swelling. Swelling is expected. It may increase from the first 3 to 5 days, then should subside within 7 days. Usually after 24 hours of procedure, you can use warm heats 15 minutes on, 15 minutes off on the side of face. That helps you to get rid of swelling and the stiffness of muscles. A warm heat cloth or towel or a warm water bottle works very well for this purpose. Rinsing your mouth. Do not rinse for the first 24 hours after extraction. No cold or hot water rinses, absolutely no rinsing. You can start rinsing the second day after meals. Rinsing should be done simply by mixing the half teaspoon of salt with the warm water and rinse very lightly for 10 to 15 seconds to keep the bits of the food out of the extraction site. Rinsing should be very lightly as it can disrupt the blood clot, which is not a good thing. Now what to eat? The food. Soft food for the first week is ideal. The food has to be cold for the first 24 hours and after 24 hours switch to the warmer foods. Make sure not to eat anything hot for the first 1 week. Try not to eat on the side of tooth extraction. Just eat on the opposite side to prevent any movement or pressure on the extraction socket, which is healing for the first few weeks. Examples of the food you could eat: blended soups, Greek yogurt, mashed potatoes, scrambled eggs, mashed bananas, ice cream, smoothies, instant oatmeals, protein shakes and nutritional supplements, milk and milkshakes. Please do not take spicy foods, no hard or acidic foods like popcorns, lemon juices, orange juices, carbonated drinks. Avoid all those for the first 2 weeks. As far as oral hygiene goes, we will discuss about the brushing and flossing. Do not brush your teeth for the first 24 hours after extraction, and after this you may brush, but avoiding brushing the extraction site for the next 1 week. And be carefully, use a very soft brush. And make sure when you're spitting the paste out, just open your mouth, the saliva and the toothpaste will fall on its own. Do not forcibly spit it out, as it can dislodge the blood clot and mess with the healing of socket. Talking about the flossing, I want you to floss regularly, but make sure not to floss the teeth close to the extraction site. Medications. I want you to take all your medicines as prescribed by your dentist. I prescribe analgesics, anti-inflammatory, as they help to reduce the post-operative pain and swelling. Follow-up appointments. You may be scheduled to return for a brief follow-up of healing or for the suture removal. If you are sutured with the dissolving ones, they will dissolve within 1 to 2 weeks after tooth extraction. If they are the non-dissolving ones, your dentist will remove them 7 to 10 days post-op. Things you should not do after tooth extraction. Don't smoke or drink alcohol for at least 3 days after tooth extraction. Do not spit for the first 5 days, as this can dislodge the blood clot. Don't suck through a straw. Don't touch the surgical sites for the first 2 weeks. No exercises, no activities for the first 3 days. You will heal much better. Then carefully return to the full activities in the next 3 days. Hope this video is helpful for you. If you like this video, please share and subscribe the channel. Thanks.